Yes, welcome to the platform. Everyone who is here, it's a Friday today. We're going to discuss our first topic today, which is heart failure. Yes, welcome, Miriam. We want to discuss our first topic of heart complication, which is heart failure, which is heart failure. Kingre is here, and thanks a lot for coming in. Thanks a lot coming in. And we want to discuss several things. Uh, we want to discuss the topics that we went through. So we are going step by step according to what we discussed last time. When the first topic was heart failure. So heart failure is we said it's inability of the heart to. Yes, it's the inability of the heart to perform perfectly what. Yes, hello. Yes. Uh, uh, we said it's the inability of the heart to perform perfectly its functions. That is what we call heart failure. You know, heart failure is not. People think that heart failure is when the heart has stopped working, because it is called heart and then fail when the heart has stopped working. Now, sorry about that. I'm still working on something here. No, it's okay. The heart failure is the inability of the heart to maintain adequate cardiac output to meet its demands. Adequate means the inability of the heart to 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 perform its function, to push blood through the system at the required capacity. You see, that is what we call heart failure. And heart failure has categories. Heart failure has categories. Let me pin the topic of the day so that everyone that is coming uh, can go through. So, heart failure. It's our first topic. So if you have any question about the heart, you can ask about the heart. So this is heart failure, the topic of the day. Let me pin it. So if any person comes in, he should be knowing what we are dealing with. Heart failure, that way. Now, it is the inability of the heart to perform to the maximum. Good morning, Dr. Benjamin, to you and everyone in the channel. Morning, Hilda Taylor. Welcome to the platform. And everyone who has come, Jay King, Miriam Mumbo is here, and Jamaican uncle has already arrived. So I was saying that some people think heart failure is when the heart fails and stops working. No, we have said it's the inability. Please don't forget to like and share also, and share so that we can see. I know so many people, the students are closing schools here in Kenya, and so many people have gone to pick their children to school. So you can define another way that heart failure is a clinical syndrome in which the heart is unable to pump enough blood to meet the body metabolic needs, or can do so only at elevated pressure. You get it? The other, we said the first one was heart failure is the inability of the heart to perform its function to maximum. And here also we are saying it is is a clinical syndrome several issues in which the heart is unable to pump enough blood to meet its metabolic syndromes, metabolic functions, can do so and only can do so if the pressure of the ventricles, I still come back to this heart, is elevated. You see that? It can only do so if the pressure of this ventricle is elevated. But at normal pressures, it cannot work. So there are several types of heart failure that we're gonna do. We're gonna go through today. The 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 types of heart failures that we have are categorized. They are categorized in several ways, And the first one is based on ejection fraction. It is based on how much blood is ejected when the ventricles are pushing, how much blood comes out of the heart, going to the system and coming back. You see? Heart failure. Oh, I've pinned down. Okay. That is the first categorization of heart failure. You get it? The second one is based on side of the heart. Left side heart failure, like we can say, let me come here and sit like this. We can say like left side heart failure, it's not pumping blood as per needed to the body, or right side heart failure is not pumping blood to the body as needed. You see? So the first one we have said is based on how much blood. It is called ejection fraction. How much blood is pumped to your body. The second one we have said is based on the side of the heart that is not performing as per needed, because the heart has two sides. It has the right and the left side, the right and the left side. And in the left side, we have the upper chamber, which is the auricle, and the lower chamber, which is the ventricle. And then we have the upper chamber on the right also, and the lower chamber on the other side also. So these ones are, you see how we go, how we categorize heart failure, how we categorize how your heart works. You get it? So we have said based on the side that the heart has a problem. Or the third one, we can say that based on onset. Did it just start abruptly? Who? And then you started having heart failure. Yes? So I think posting these types of heart failure is important, because someone can be going through them. Types of, so the first one we have said is based on ejection fraction. Based on ejection fraction. And then we have the other one based on the side that the heart has a problem. It can be the left or the side. Left side heart failure, right side heart failure. Those ones are categorization of heart failure, how the heart behaves. And then we have based on onset. Is it acute? Is it chronic? You know, there are different types of heart. There, how it starts. It can be acute. You've never had any heart failure, but one day you just collapse. You go to hospital and you are told you have a heart failure. That one is acute. But when you are given some medications, you go home, and it takes a very long time before you feel anything. That one is called acute heart failure. And then we have chronic, those people that are always on drugs, because maybe we know the left side of the heart has a problem or the right side of the heart has a problem. That one we know it is heart failure that is chronic, continuous. This person has to live on drugs. And then we have the fourth one based on cardiac output. Low output heart failure, high output heart failure. You check it out. Output means the amount of blood that comes out Uncle, good morning. Have a blessed day, and I hope and pray that the throat is feeling much better now. Yes, Uncle will do better. He is a strong one. I think the pollen and sometimes coming online and talking has affected. So, Uncle, yesterday he didn't have a live because we wanted him to relax, to have a chilled throat. Hmm? Uncle will be fine. No, he is a strong man. Now we continue. We have categorized heart failure into how many? Four. Four categories. We have categorized heart failure into four categories, and we have said one is based on ejection fraction. I think writing and post-pinning them is important because some people that come late, they can relate. So I pin this one here. Will people see? Let me see. Yes, I'll pin this one here. Now we have said types of heart failure. Types of heart failure. The one number one is based on based on ejection fraction. Number two, we have said based on the site affected. And then we have another one, which is number three, based on onset. I'm gonna pin those ones first. So that we continue to learn how these are coming. So we start by based on ejection fraction. Barbara, I'm seeing you are here. Welcome to this topic today of heart failure. Barbara is here. Barbara, a very jovial lady and always kind. She talks Luganda and you feel well. Barbara talks Luganda and we feel well. I told her to teach me Ugandan language so that as I listen to Ugandan song, I'm flowing and flowing. I love Ugandan music so much, but on some things I don't flow with them, but I catch up because Ugandan language with our language sometimes they come closer, but some things I don't. Now we continue. We start with based on ejection fraction. Ejection fraction. When it comes to how much blood, good morning, Benjamin, and everyone else watching. Welcome, Johnny Be Good. Today we are talking about heart failure, and we have said heart failure is not when the heart is not working. When the heart is not working and it is there, it means death. So we are not talking about that. We are talking about how the heart is affected and the categorization. So I've posted three based on ejection fraction, based on the side affected, it's left or right, and based on onset. Is it acute or chronic? I see Majay B in the house. Majay B, welcome to the platform. Now let's learn. You are the one who told me to talk about heart failure, and you see the day has come of heart failure. Now, heart failure classification based on ejection fraction. That one is the percentage of blood pumped out of the left ventricle with each contraction. How much percentage of blood is pumped out of this here going to the it is a key measure in diagnosis and classification of heart failure. So my guys, my people, my friends, everyone who is watching me and everyone who will watch later, as we learn, we have said heart failure categorized by based on ejection fraction is just not how much blood goes out of the body, but how much blood comes from the left ventricle, goes to the outer, and is pushed to the body. Because this blood that comes from the left side of the heart is oxygen present. It has good amount of oxygen. You see that it has good amount of oxygen. Yeah? So when it contracts like how much percentage of blood comes out of this and goes, you get it. That is what we call ejection fraction. Yeah? Heart failure with reduced ejection fraction, that is the first one. So if blood is coming into the heart and the amount of blood that is in the left ventricle, I think it is good to explain so that people can learn and listen to me and listen to what I'm saying. It is good to learn. Let me make a call if it can be. I want to draw the heart again. I want to draw the heart so that I can explain to people to get to know the first. You see, we have categorized, we have three types of heart failure. So we are at the first one, this one, which is based on let me call again, just a minute guys, just a minute. I make a call here. It is important call. Now let me draw the heart like this, like this. I like drawing hearts. I'm a person who loves hearts. I like drawing hearts. So just a minute, I draw my heart so that Benson. Yes, so kimbia unione Andrew. Kimbia unione. Now, I want to explain what it means by heart failure with reduced ejection fraction. That is our first type of heart failure. Now, you see, this is a heart I'm drawing here. This is a heart I'm drawing. This is a heart I'm drawing, and this is the left side. So this one is the where blood comes from the lungs, and it comes, the one that I've just drawn. Look here. So, and you see, this is the blue side is the left side. You get it? The blue side is the left side. So when blood comes from the mobile subscriber cannot be reached. When blood comes from the lungs and it comes here in the left atrium, that blood should come to this ventricle. Why does it come to this ventricle? It comes to this ventricle because this muscle is tough. And if this muscle is tough, it has the capacity to push blood to the system. We have the outer here. So blood comes and it is pushed through the outer to the system. You get it? That is the outer to your body. So this means that there is a percentage of blood that comes here. Everyone has got the percentage. Let's say it can be 200 ml. So your heart, my heart, let me call my heart. My heart at the left ventricle has 200 ml. I'm explaining reduced fraction. I'm explaining reduced fraction of I'm explaining reduced fraction. So when blood comes, there is a percentage that is expected. Ima,
Yes.
uko job?
Nilikuwa nimetoka.
Oh, unarudi? Oh, Andrew yuko?
Yako.
Simu yake haingii. Just a minute please. Simu yake haingii. Acha mwenye nimetuma afike aambiwe, ama uambie mtu huko, ambie Andrew apeane normal saline 10 infusion mtu yeyote mwenye unaweza pata.
Sawa.
Okay. Sorry about that guys. So when blood comes, my body receives 200 ml on the left ventricle. You get it? If your heart, when this ventricle pushes so that blood can flow, only 40% of 200 ml in this ventricle, 40% of 200 ml is pushed because maybe the left ventricle has a problem. It means what? Heart failure with reduced ejection fraction. We have understood that. Let me repeat. It's very important to listen to this. That very important you listen to this. The first heart failure we have said is heart failure with reduced ejection fraction. So if my heart receives at the left ventricle 200 ml, and when you pump, it is about 50% of.
Sorry, the mobile subscriber cannot be reached.
Sorry. It's above 40%. Maybe say 50%, maybe say 100, even 100%. Like 200. Your heart cannot pump more than the whole blood, because when you pump, some gets it. So 200 ml must go to the body through the outer. So when this left side to the outer 200 ml flows, it means you are good. But if it is only 40% of the 200 ml, I'll say that I have systolic heart failure. Systolic heart failure. The heart muscle is weak and cannot contract effectively. This heart muscle is weak and cannot, I don't know. Let me check if I got a heart itself. Sometimes we have dummies. Just give me a minute. I confirm if we have a dummy to show you, because when you see the heart pumping, you will find that when you see, you will appreciate. Let me see if it is not being used. I come with it. Yes, sorry. Unfortunately, there are some people that are using the dummy, and we continue. So I'll just explain. So I've said that if my left ventricle received oxygenated blood from the lungs, about 200 ml, And then the 200 ml of blood is the 200 ml of blood, only 40% is pushed to the body. It means that the ventricles, sorry, some confusions here. It means only this ventricle maybe is weak. This muscle here, this muscle, this one, maybe is weak and it cannot push blood to the body. It cannot push blood to the body as needed. So only 40%. So if it is, when we measure and we see it is only 40% that goes to the body, we know that there is a problem. So we say maybe the ventricle has no power to push blood to the body. So that one we say heart failure with the reduced ejection fraction. Ejection fraction means the blood that goes to your body after it has received oxygen to them. So that one is heart failure with reduced ejection fraction. And what causes heart failure with reduced ejection fraction? The heart muscle, maybe the heart muscle can be weak, cannot contract and push blood effectively, reduced pumping ability, reduced pumping ability. You get it? The heart muscle has reduced pumping ability. And what are the causes? What can make this heart muscle to have reduced pumping ability? What can make? One is, you remember we talked about myocardial infarction. Myo, when I was explaining, myo is muscle, cardia is the cardiac system, which is the heart, and infarction is a dead place. Maybe this heart muscle is undergoing a problem of getting oxygen and it is dying off slowly. There is other problems that are called dilated cardiomyopathy. We will learn about that, and chronic hypertension. Those people that have hypertension always they are having hypertension. And then you start having heart failure because of high blood pressure. Of this side, you don't have the capacity of your blood being pumped up to the body. You will start having fatigue, dyspnea, shortness of breath, and reduce exercise tolerance. Because if this muscle of the left cannot pump blood as per needed, your brain will not get enough oxygen. Your body tissues like the liver, the thyroid, and other tissues that are in the body, they will not get enough oxygen because this muscle is not pumping blood as per needed. You check it. Please, if you have, I'm going slow because if you have a question, you just ask. We want to understand what is heart failure. And the treatment, we give some drugs to stop the heart from beating fast. You get it? They are called beta blockers. Or we give diuretics to remove excess fluid so that this heart can do what? Can have light duty. Diuretics, you remember what we talked about? They are drugs that remove excess water from your body. So when excess water is removed from your body, you have low volume of blood. So this muscle, if it has a problem, it will have less work and it will continue pumping red blood cells to your body. You see, now there is this other one. We are still on the ejection fraction. Ejection fraction. In ejection fraction, being a teacher is fun. No one even asking me a question. Ejection. I think if you eat healthy food, exercise will prevent the breakdown of the body. Yes, Johnny be good. Johnny be good, yes. But now we are talking on the people that have already the problem and how we can solve the problem. And that's why we are helping each other. So ejection fraction, that one is based on ejection fraction. And one we've said is, we have said is ejection fraction. The one we have started with is less this ventricle pushing less than 40% of the blood that is here to the body because of the things that I've explained. We continue. There is another one, with the second one, which is heart failure with preserved ejection fraction. Preserved. With preserved ejection fraction, what do we mean with preserved? Hello? Yeah, mambo? Kiasi tusema. Uko town ama? Ni nini hiyo? Niambie. Oh, sawa. Let me get back nikimaliza session. Okay. Now, sorry about that. Someone was confirming. So we have with reduced ejection fraction of 40%, but we have preserved ejection fraction of more than or equal to 50%. Preserved. Also called diastolic heart diastolic. You see, this one is called systolic. This one is systolic. This one is diastolic. That one is diastolic. So when we come to diastolic, it says heart contracts. Our heart, my heart contracts normally, but it is stiff. It is stiff. It contracts, but it can't relax. You see, it contracts, but relaxing has a contraction is okay, but relaxation is a problem. So when it contracts, there is a problem. When contracting means it pumps. You get it? But relaxation, coming back, is a problem. When it contracts, it gives about 50%. You get it? Or more than 50%. So when we talk about contraction, like when it contracts, it gives more than 100 ml. 50% of my 200 is 100 ml. But the problem comes, it has already pushed. Now, coming back is a problem. Beauty in the house. Welcome. We are talking about heart failure. Coming back, this muscle coming back is a problem. The heart contracts normally, but it is stiff. Impaired relaxation, reduced feeling. So when it comes back, the blood from the lungs that have oxygen have a problem when it comes to feeling. You get it? It has a problem when it comes to feeling. So that one means you are pumping more than blood that is needed, yes, but coming back is a problem. If you are coming in right now, we are talking about heart failure. So people, give the likes, and don't forget to share. If someone has a problem, you can also share about the problem, or you can also do what? Share to a student who is a medical student, who is learning and who is going through these sessions. Now, you see those differences. This one is, this muscle has a problem. It can't push more than 40%. But this one is another problem. Preserved ejection fraction. So preserved, there are two. This one is 1, this one is 2. Preserved means it pushes the blood, the whole, more than 100. If the blood goes, but the heart has a problem when coming back so that it can feel. So this muscle pushes, but it can't come back normal. That's where we say preserved ejection fraction. And this is a problem when it comes to people who are diabetic. when you ask a question, why are people who are diabetic always have hypertension? It is because you have too much glucose and it is affecting the muscles of your heart. So too much glucose affecting the muscles of your heart is a problem. Why? Because it will push blood, but relaxing will be a problem. So it will push more than 50%, go to your body normally, but coming back is a problem. You get it? And afternoon smile in the city. And do you know what happens? Those old people that have pressure, we call them isolated hypertension. You find that the systolic one is 160. I explained about this one time. And you find that the other one that is down is 60. Isolated hypertension. So this is always the problem at old age. People that are aging and the above pressure is more high and the lower one is low. These people don't need drugs. If they need drugs, the old age, you go and you find that an old age as the one in Kenya, we say someone has they call it pressure ya uzee. In English we say it at hypertension at old age. These ones don't need, we will see why they don't need drugs, but they need follow-up. So we don't just give people drugs because the high pressure is high. You see the factors that we check on so that we can give drugs. Very important factors. You go to a hospital and then a nurse or the person at the desk there gets your pressure and then says, your upper one is so high, your pressure is so high. Understanding, these people does not understand the physiology, the function of the heart when it comes to heart failure. Now let's continue. Who else can have this category, this problem? Diabetes mellitus, aging, old age, and long-standing hypertension. People that have hypertension that has gone for so long, high blood pressure. You always feel dyspnea. If you feel if you feel you are having dyspnea, yes, Andrew. Tafadhali mpe normal saline 15. After this session, I'm paying immediately, please. Okay, infusion, eh? Okay, sorry about that. Now you understand. There are some people who have been asking me, why is my systolic pressure so high and the one that is down so low? We now know why these things are like this. You understand? We know that when your heart pushes more than everything that is in the ventricle, more than 50%, but when it pushes, it has the problem of coming back. Note that it is called preserved ejection fraction. Isolated hypertension. You see, that is the second one. We are still on the fraction, heart failure, and the volumes. You get it? So we continue on heart failure with mild reduced ejection fraction. Well, how is that? 41 to 49%. Mild reduced, let me write it here. Please, if you have a question and you are following, please just ask. Mild, the third one is, the next time we'll be having a very big board so that I can be writing when I'm standing. I like standing. So mild reduced ejection fraction. Mild reduced ejection fraction. It can be from 41 to 49%. You are having it is between low blood that is taken to the body or just before low, mild reduced. Yes, it is, your heart is pushing blood, but it is pushing reduced blood that is okay. I can say it's okay or not okay. We can say borderline. This one is features of systolic and diastolic dysfunction. This systolic dysfunction is when the heart is pumping, the ventricles are the problem. But when the heart is resting also, the ventricles have a problem. Here, when we are talking about ejection fraction, we are talking about the ventricles of the heart. These muscles that are down, these muscles that are down here, not the above one, these muscles that are down. That is what we are talking about, ejection fraction. Because they are the muscles which pump blood to the lungs and to the body. You get it? So those are the three complications when it comes to amount of blood that is coming out. Jamaican uncle almost miss you. Oh, uncle, you'll be better. You see, people, it's just one session and people are so missing you. No, that is it. How blood is pumped from the heart. That was a session of anyone with a question of ejection fraction, please post it. And if you are watching and you've not liked Bwana, hey, Bwana, I'm really, hey, hit the like button, hit that one. Yes, say I like the topic and I would like to know more. Share it to a student somewhere. Let this student appreciate. I know we have children and students that are doing medical courses, and this will be so helpful. They look so basic, but they help them understand the practice, yes, at school. So introduce your children to Dr. Ben online, Dr. Ben, to help them study and understand these basic things. These are basic things in the world of medicine. Now, that was ejection fraction. The first one is reduced ejection fraction, preserved ejection fraction, I've explained, and mild reduced ejection fraction. So mild reduced is in people that are at an age of intermediate group, 28, 29. You see, features, and I've said, when the heart is contracting, it has a problem at mild ejection fraction. When it is relaxing, it has a problem. Now, that one I've explained so well. What do you think, guys? I've tried to explain so well. Now, who is not getting it? Who is not getting this? Now you know why when you are old, your upper one BP is high than the lower one. Now you know why a person who is diabetic is also hypertensive. It is called glycosylation. Glucose going to the muscle cells, and then it piles up, and then your heart fails to contract as it pumps. So it gives you this BP. The systolic one is always high because when it is pumping at a high rate, but when it is relaxing at a very low rate. So we have done our ejection fraction, heart failure. That was first, based on ejection fraction. Now we are going to don't just look at me, my friends. Smile at me at times. Smile at Dr. Ben. Let Dr. Ben feel nice when you are smiling at him. Now let's go to based on the site affected. Now we remove ejection fraction. We go to based on the site affected. Your heart can be affected both sides. Dad's page, welcome to the platform. Hit the like button. Ask me any question that you feel that you can ask. You know, sometimes I feel that Dad's page TV, some people I feel they are medics and they get so much when I'm here. and talking. Yeah. I feel some people here are medics and they ask me question after I'm not online. They ask me question. Yes. So if you are a medic, challenge me. Please ask me a question. Ask me why I'm saying this and not that. But when a medic is watching me and is not asking a question, the medic knows that I'm on point and I'm pointing it. Now, sorry, smile in the city. I'll try my best. Okay. So, my friend, Uncle has a sore throat because of some issues, pollen and talking to so much. But Roger's killer is taking over for some time. Those that know, you know. Now, based on the side of the heart, side affected. Based on the side affected, this is the second one that we have talked about. You can have heart failure. Is Majay B, are you still around? You told me to talk about heart failure. Now you understand that heart failure is not just a walk in the park, it is a long topic. We are at number 2, based on the side affected. Left-sided heart failure, which is most people have left-sided heart failure. This side of the heart, most of the people have. Let me bring this like this. Some people wants to see the heart. Some people wants to see the heart. Based on the side affected. So we have left side. Majay, so I know you are curious to know about this. So, Majay B, prepare your questions. I'm waiting. If you've not liked anyone in the chat, please like Buana. Share. Tell someone today is a topic of heart failure. Let's listen to the doctor. Now, left side heart failure. And do you know why the left side is really affected? Do you know why this left side is really affected? Because systemic circulation is very long than pulmonary circulation. And I will draw my person again. So that you understand what I say. I like people understanding things and understanding things so well, so that if someone asks you, what did Dr. Ben talk about? You explain as if you are Dr. Ben. You get it? You explain as if you are me. So this person I'm drawing to make you understand what I mean. So your heart is here and your lungs here. So your vein comes, supplies, and then this one takes to the brain, lungs here. Now look at this. There is something I want you to understand before we continue. This is my person. The heart and the lungs are at the chest cavity here. At the chest cavity. I don't know if this one can come here so that you can view it well. Put it here. Now, this is my person, and from this outer, the outer is here. This outer, the left side of the heart. The left side of the heart pushes blood from here to the legs, to the brain, to the whole body. But the right side of the heart, only pushes the blood from here, the heart, to around the heart, the around to the lungs. You see this right? When it comes, it pushes to the lungs. The right side pushes to the lungs. But this left side pushes to the whole body. Now you understand why the left side works so hard, and mostly when you are aging, this muscle is the one which brings problems because it works so hard for so long. You get it? It works so hard and for so long. It works so hard and for so long. The left side of the heart, works too much. The left ventricle, blood backs up in the lungs at times. Here is, I think I need to draw the lungs again, like that. Again, your lungs are like this. So this is your lungs, and when this blood from the left ventricle comes to your lungs, it is supposed to go back when it has oxygen. The lungs are like this, and your heart is here. Your heart is here. So when blood from the lungs, you have a problem in the lungs like TB, you have bronchitis, you have complications of the lungs, chronic coughs. Sometimes blood stops circulating normally. So what happens is, what you are remained with is low blood that comes on the left side. You get it? The left ventricle fails because now you don't have enough blood. That one is based on the side affected. Mostly, left side is affected because of that. When blood from the lungs is pumped, it's not coming out, or there is a blockage in the lungs. When there is a blockage in the lungs, blood cannot come to the left ventricle as needed. You know what happens? There is a problem. And this problem is your ventricles will not function well. Mostly the left ventricle that pumps blood to the systemic circulation. You get it? So we have another one which we call right side heart failure. Now, the right side, the side that pumps blood to, it pumps blood to the lungs to get oxygen. The ventricles just fail. And then blood backs to the systemic circulation. This one cannot pump blood to the. If you have Friday blessing to you all. Hello, doctor. Welcome, welcome. The right ventricle cannot pump blood well to the lungs. So if it cannot pump blood well to the lungs, what will happen to the left side? The left side will not have enough volume to pump to the systemic circulation. You get it? That one is mostly brought by ventricular causes, like you can get infections, problems with the ventricle itself. So we have something called, let me write here, based on the side. So we have left side failure, right side failure. And then we have the third one, which is by ventricular failure. By ventricular failure, both of the ventricles have failed. So not any is performing normally. I noticed that some people who take the corona shots having some heart problems, even as much as teenagers. What causes that, doctor? Yes, Uncle is asking. He noticed most of the people that took the coronavirus injection, they started having heart problems. And what do you think can happen? Heart problems, when it comes to blood, it is caused by mostly coagulation and some autoimmune effects. When I'm talking about autoimmune effects, you understand. It means that maybe some people who got the coronavirus injection, they had a problem of clotting. And that's why before you got a COVID vaccine, there was a place you were asked. Yes, Betty's World, welcome. There is a place you were asked if you have any allergy to any drug, or if you have any allergies of food. You get it? So corona vaccine, let's talk about that. We have finished about based on the side affected. We go to the next one. So vaccines and heart failures, they are like this. Let's see. It is very important you've brought that in this topic, because after COVID, there are so many people and many things that happened. If you are getting in, please, if you have not liked the topic, continue liking the topic, continue sharing to the people that you know can be interested in. Because you see, like the topic that Uncle has brought, that one is a very important aspect. It is a very important aspect. After the vaccine, what happens? One thing that you can notice when you have a vaccine is not corona vaccine only can cause a problem. We have some vaccines like pneumococcal that can cause. Thank God I didn't take corona shot. Beauty was avoiding it like some people are very afraid. Yes. Okay. Some vaccines like pneumococcal, they can cause pericarditis. They can cause infection to your heart. And some vaccines like, let's say COVID vaccine. Let's talk about COVID itself. What COVID can do. You know what, when you go and create a vaccine, this is what happens. You take the vaccine, you live and attenuate it. You reduce the capacity of the virus to harm you. So when you reduce the capacity of the virus to harm you, what it does, it comes back to your body learns how to fight that virus by creating some things that are called antibodies. Antibodies are created. So your body knows how to learn it. You get it? So when COVID was introduced to some people, it caused something, some, not all, myocarditis, the inflammation of the heart muscles, because it was fighting the corona. For your body was fighting the COVID, because it was. I wish I introduced this topic on immunization. Immunization is you take the virus itself. Sorry, just a minute, guys. You take the virus itself and then you kill it partially. You kill it partially and you introduce to the body. It will not harm that person, but the body will learn how to destroy the real vaccine, which is not partially killed. That is the simple way I can say. It is called live attenuated vaccines. Those ones are like viral vaccines like the one of COVID. So when COVID was introduced to your body, what did it do? It started causing inflammation of the heart, and causing inflammation of the heart muscles could not perform well. And you see, inflammation can go for some time. And when I introduced a topic on inflammation, what did I say? Inflammation is three things. One is redness. The second one is hotness of the place that is undergoing inflammation. And the third one is swelling. That is explaining inflammation, is swelling. You get it? So those ones are three signs of inflammation. But imagine now the muscles of the heart undergoing inflammation. It is called myocarditis. It reduces the contractility of the muscle. I'm talking about the COVID vaccine. To some people that were affected, it reduces the contractility of this muscle, and so you may have, where is that? We go back to our types of ejection. You may have systolic reduced ejection fraction, reduced or preserved, according to if it is affected, the inflammation is around there, it is called biventricular, mild reduced biventricular. But if it is the inflammation was on the left side, it is called reserved ejection fraction. Now you understand what happened during that time. It can cause worse pre-existing heart failure. Maybe you are given that vaccine and you are undergoing heart failure itself. What will happen? It will be worse because it will cause the condition that I've said, myocarditis, inflammation of the pericardium and the muscles of the heart. You see, so these ones, if you have a question on that, please raise it. Now you know what happened during that time. Or there is another instance. It can cause something that is called clotting. Some people received it and it started forming clotting in the system. So when you reduce these vessels from pushing blood, you start having a heart that is swollen because more fluid is left in the heart. That is what coronavirus did to some people, not even COVID, the coronavirus vaccine, like the pneumococcal vaccines that we always have normally. COVID was just one of it, and it people are immunized at child, and as you grow, you forget about immunization. But when COVID came, it made people to be exposed to immunization, not knowing some people are older and they are having some comorbidities like heart failure. You can have heart failure and you've never gone to the hospital. You have never gone to the hospital. You are always taking painkillers when you get a pain in the heart, and you never go to the hospital because maybe you have mild reduced, the third one. So you neglect the signs and you say it will go well. So I think I've answered that questions as per needed. We continue to the topic of the day. The topic of the day was heart failure. We have done reduced fraction. We have done based on side, left or right. Now we go to based on onset before we go to based on cardiac output. We go to based on onset. What is based on onset? There are some categories of heart failure that it can go to acute. Acute meaning sudden development of signs and symptoms of heart failure can occur in previous normal heart failure or top or chronic heart failure. Sudden, you're just walking, you're just seated, you are doing your things, and suddenly you get an attack. We can categorize them in this way: acute or chronic. Causes mostly are severe hypertension. I'm still going to people who are hypertensive. So if you are hypertensive, you should get to take your drugs well. If your heart beats irregularly, go and do an echo to find out what is the problem, because you can get acute heart failure. You get it? And then you start feeling sudden shortness of breath, pulmonary edema, and rapid deterioration. Pulmonary edema means the blood vessels that go into the lungs, they start having a lot of fluids and your lungs swell. You start losing the breathing. Because if blood is not getting out of your lungs as needed, you will not breathe well. Your lungs will swell. You get it? And it's a medical emergency. And then we have the second one, which is, this one was based on side. So we are based on onset. Based on onset. Acute or chronic. So acute means sudden, but chronic means continuous. You are having a heart problem and like rheumatic heart disease, and you are diagnosed, and every time, sometimes you get a flu or you get another disease, it spikes the onset. You get it? So that one is very simple: sudden onset and non-sudden onset. Now we go to, if you have a question, my friends, don't feel shy, please bring it up. You see, Uncle has brought a very important question, and that important question has helped some people. You get it? Now we continue. Where is that? Someone is saying left. Okay, we continue. We continue on the last one, which is based on cardiac output. Based on cardiac output. I think the first one was the most important one. Cardiac output means, just a minute, guys, just a minute, guys. Cardiac output means the amount of blood that comes out of your, heart. If it is reduced and does not meet metabolic demands, when heart muscles have no capacity to pump enough blood to go to your body. Also, we are talking of the left side. To take oxygen to do metabolic actions, to go to the cells. Weak heart pump. Stroke volume is reduced. The volume that the muscles are pumping up, going to the body, is reduced. You see, that one is called low output failure. Low output failure. And the most causes of low output failure is myocardial infarction. I've talked about myocardial infarction. These ventricles dying because of oxygen, myocardial infarction. These ventricles dying because they are not getting oxygen from the coronary artery. The coronary artery. We say it. People that smoke, I'm still on you. People that smoke, where is another paper? I want to explain this. This heart of mine has this one that takes blood to the lungs, but it has, let me draw it correctly. It has this one that takes blood to the body, but it has this one that takes blood to the lungs, this pipe here that takes blood to the lungs. So this one that takes blood to the lungs has 3 diversions, but one comes back. It is called the carotid artery and gives this heart some, you understand, and gives this heart oxygen this one. So this one that has come back and is giving this heart oxygen and nutrients, this one, can medication help when the ventricle is dying? We will see that. Maybe there is a blood clot here, and this blood clot, or you've been taking cigarette for so long, and you have an infection and it's piled within these layers, and it's making this, or cholesterols that have come to this one that is taking oxygen to the heart, and it is constricted. So the part of your heart, like here, part of this heart is getting less oxygen here, and it is starting to die. That is where we get myocardial infarction. Myo means muscles, cardia means heart, infarction means dying, death. So here you start having a dying. So this is the common cause when it comes to low blood ejection. So if you have myocardial infarction here, this heart has no good capacity of pumping blood on this side. You get it? So the ejection fraction, the blood that is pumped from this side becomes so low. It becomes so low. You get it? It becomes so low. You get it? You start having cold extremities. You start, Gabriel, welcome. You are coming late, but it's okay. Come late and ask me a question on heart failure. Now, MaJB, have you seen how heart failure is a big topic? And this one is just one. And then that one the one we talked about is low output because of those myocardial infection or valvular disease. I'm trying to look, I'm using a lot of papers, but it's okay. As much as people are learning, I'm okay with it. I'm okay with it as much as people are learning. I'll continue writing on these papers until I get a good board that I can write and you see well. Now, myocardial infarction is one. I've explained about myocardial infarction, but we have another one which is called dilated cardiomyopathy. We'll talk about it. Severe hypertension can cause low output, and because the heart is beating randomly and is beating in a bad way. And then we have valvular disease. Valvular disease means these valves cannot hold blood. So as the muscles are pumping, the blood is coming back. Please, if you are here and you are smoking or you are watching this, you will watch this and you are smoking, stop smoking. Smoking gives you rheumatic heart disease and these valves die. So the blood comes back, valvular disease, and it is bad, it's not good. You start having cold extremities, weak pulse, narrow pulse, you get it, confusions at times. So we have dealt with, this is based on side affected. What we are dealing with is based on cardiac output. What is cardiac output? Cardiac output is blood. Blood is the one which is poured out from the, don't worry, Benjamin, later we have to give you some super chat to come on, Uncle. That's why at times I let you. to buy some more papers. Yeah. But now, based on cardiac output, we are at the last one. Cardiac output. Cardiac, I've said is cardiac output, I've said, is the amount of blood that comes out. Cardiac output. When you go to study, students that will listen, when you go to study in university and you graduate, you come out here, we need your output. The lecturers who are giving in. So when you come out here, we need you to be helpful, output. So the heart, as it takes in blood, we need output of blood. So we categorize this heart failure with the amount of blood that is coming out of the heart. So you can have low or high. Low or high output. You see, categorizing based on output. You can have low or high output. And we have talked about low output. Cardiac output is reduced. That one I've talked, and I've said, I've explained about the myocardial infarction, death of some ventricles or reduced oxygen, and some causes like hypertension and valvular disease. These valves, the mitral valve, the aortic valve, the pulmonary valve, and the tricuspid valve. Now, we have this one, high output. How does high output comes in? How does high output comes in? Define high. Cardiac output is normal or increased, but still insufficient for the body's need. The heart is pumping well, but the demand is even more. Why? Because systemic vascular resistance or high metabolic demand. Heart overworks. Eventually it fails. Very sad. Very sad. It's very sad. It is very sad. It is very sad. It is very sad. The heart overworks. Why? Because the heart is pumping well, but your body demands are high. You know, people that exercise too much, the people that go to the gym too much and run so much, at the end of their years, they have heart complications. Why? Because you are forcing your body to have high metabolic function. You are forcing your body to create more energy for long exercise, for long hours, until your heart pumps, but the amount of oxygen that is going to the tissues is not enough. So you have a heart that is pumping so fast. And the systemic vascular resistance becomes low. What am I talking about systemic vascular resistance? Because now your blood vessels, your arteries are like this. This is the normal size. But because you are overworking the gym, running, working out so much, or you can have a cancer. Cancer, I always say, it is an energy eating thing. So your body needs more energy. So this is the size of your normal artery, but because you are giving more, your heart is giving more and pumping so much, it becomes always bigger. So when it is bigger like this and you're always forcing it, because as you plant, you push a lot of blood. I'm always dancing. Leila, come on. Oh. Dancing is a good thing. It keeps you fit. As you're pushing blood from your muscles, this is your normal blood vessel like artery, it becomes wider. So it becomes normal that instead of being this one, it becomes this. It becomes normal vascular resistance is at the normal. You get it? This becomes the normal instead of this. So you start having heart problems because this heart will be pumping to serve this instead of this. So resistance of your blood vessels, the amount of pressure that is given at the heart pressure like this becomes low. It's like a bladder. We call them bladders. When you stretch them so for long, they lose their capability of becoming, of stretching and coming back. So this is how you even your blood vessel behave. You get it? That is how your blood vessels behave. So as you are listening, my friends, as you are going on and listening about this discussion, I want you to go back and start from it. We have learned about low output and high output. So high output for the people who are compensating, like runners, gym, normal, or people who are sick with if you are coming now, please just leave that like. I will feel nice and I will smile. People that have cancers, most of them, you will find 75% of them are, the weight goes down because cancer is an energy consuming complication. And the heart itself will always pump a lot of blood faster and faster to the systems where cancer is so that it can serve the cancer. Oxygen, high metabolism is needed. And that's why after some time when a person has cancer, you will find this person becoming thin and thinner. So based on output is the fourth one that we have discussed. Guys, you see how heart failure means? Heart failure is not a condition whereby you have a failed heart that is not working. You have a failed and the heart has just died, and you're not. It's if your heart has died and it's not pushing blood, it means you are dead, or you need a plastic one. Yes. So we have talked about several heart failures, types of heart failures. Remember, we started with based on ejection fraction. Where is it? Based on ejection fraction. And then we went to based on the site which is affected. And then we based on onset. We said, based on onset, is it acute? Is it acute or chronic? And then we came to based on the side affected, left side or right side, or is it the whole heart? You get it? Based on onset was the last one. Oh, and then no, was the other one, and then we go to the last one, which is based on output. Is it low output or is it high output? So you see, those ones are categories of heart failures. And an athlete I treated had large blood vessels that they cause stretch marks above them. Oh, CJ Rehab, you see, you are a medic. Now let me help you know. An athlete I treated had large blood vessels that they cause stretch marks above their body. He shocked everyone when he had a severe diagnosis with enlarged heart. CJ Rehab, now you know why this athlete had CVA. You know why. So which drugs did you use? I want to know, CJ Rehab, how did you treat the varicose veins and CVA? How? Please give me a way you treated. Tell me how you treated this. Because if you have a large heart, it means you are having, if you have a large heart, it means you are having a lot of fluids in. And CJ rehab, it means if you did an X-ray of that person, this person had a boot-shaped heart. Boot-shaped heart means, I'm talking to CJ rehab, boot-shaped heart. Let me draw a boot-shaped heart. This is your lung. This is your lung. The boot-shaped heart like this. Like this. I treated him after CVA. Okay. Cardiovascular. Okay. He had a cardiovascular. You know, CJ rehab, now you understand the cascade of things. The accident, the cardiovascular accident did not come just like that. This person always had a heart complication because of extreme exercising. And maybe the right side or the left side of the heart had a problem by pumping blood, and this guy got transient ischemic attack. Transient ischemic attack. So the cardiovascular accident started while exercising with time. The veins lost resistance. They became here. The ventricles became larger. This person became, if you did an ultrasound or if you did a chest X-ray, this person had a heart that is looking like this beneath the lungs itself. You get it? CJ rehab. So after having a boot-shaped heart, you get me right, my friend CJ rehab, boot-shaped heart, it means the side of the right side had a problem pushing blood to the lungs. See, very fine. I'm trying to help someone to understand. I'm talking to CJ rehab. Yes, he had transient ischemic before the CVA. Yes, I'm explaining how it came up, CJ. It's a cascade of events, mostly in athletes. So, because this is my heart, and this is the pulmonary vein, it takes blood to the lungs, and then the pulmonary vein, this is the pulmonary artery. The pulmonary vein brings back to the heart, and then the outer takes to the body. So as this person was exercising so hard, the vascular resistance became so high, and he had a boot-shaped heart, and this muscle was stretching, and it could not take blood to the lungs. So blood piled to the lungs, until the left side of the heart could not serve the brain. So he had a transient ischemic attack, cerebrovascular accident, loss of oxygen in the brain. And why did this person have varicose veins? Varicose veins come because of this vascular resistance that is distorted because of exercising so high, until these veins that are supposed to be like this becomes bigger. So you see them, they protrude to your legs. Those people that have varicose veins always have have problems with hearts. A person, if you have if you have a person who is your relative, yes. Wait, nani? Mwambia ngoja mna lesson. When you have a relative that have those, you should do what? You should explain, please go to a doctor. You have seen how I've explained varicose veins. So CJ Rehab tell us, hey, our time has gone. If you have questions, let's continue asking. Let's continue. I've said we have dealt with, and you see, people that are medics and are working in hospitals like CJ Rehab, they are appreciating and now they are learning how some things are coming out. I was not with that patient, but you see how I'm explaining. CJ Rehab is bringing out the the occurrence of events like transient ischemic attack, like the other things like what? Let's continue having let's, as we finish, let's continue asking questions, please. CJ Rehab, I want to know how you treated the varicose veins. How did you treat the varicose veins? How? Tell me how you treated the varicose veins, please. And we interact. Now, we have dealt with very important things today. The very important thing that we have dealt with, one, is ejection fractions and complications of the heart. Okay, now I deal with something just faster. Please, if you have questions, put them here. Put them here as I come to finish the topic. If I need like one question before I finish, please post the question. Yes, I'm here again. No, any question has come, not varicose veins, but stretch marks from enlarged veins. He had low body fat, so it was easy to see them on his hands and legs. Yes, CJ Rehab, those are stretch marks. Those are varicose veins. If you see them and there is a stretch mark, just know those are varicose veins. We will discuss about them on complications of hypertension. complication of hypertension. So, guys, we have studied about Majay. If you are still here, are we going to have a test at the end? How many will pass with flying colors? I am excited by Dr. Men intellect. Thanks, dudes. Thank you so much. But please, guys, share these contents. Yeah, we need more people to be here. Share these contents. I love your insights. I love everyone's insights. Yeah? And very soon we'll be having a hospital with a good presentation, with a good board. So don't worry, we are going to move step by step. Anyone with any question? Anyone? I can see Beauty. I can see Betty's World, Dudes here, Jamaican Uncle, Miriam Mubwa, Gabriel. Yes, thanks so much for tuning in. And everyone who has Leila Ali, my friend, welcome so much. Welcome. Thank you for being here. Majay B, I see. Now you have answered your questions. I know you are so interested on heart failure. And you know heart failure is just the first one. We have not solved, we have not gone through the other ones. So I know right now you have answered your questions and I feel happy, but I am not seeing any question that you've asked me, but you've asked me several. Good afternoon to everyone. Life with Rasels. Come on. You're coming when you are going. Thanks so much. So you've learned about heart failure, but we will deal with after we finish the complications of the heart. We will now try to work on them step by step. For now, we are learning how these events come. You know, it is very important when you learn the events. When you learn the events, and then you know how to manage. Because when I'll be explaining on how to deal with based on cardiac output, based on low and high, someone will be appreciating, say, oh, so this drug does this so that this ventricle cannot do this. You see, you will appreciate. So if you are following the topic on cardiovascular, thanks Life with Razel. Thanks so much. If you are following, please. Oh, thanks so much. You follow, even if you miss a live, come back and follow. Come back and follow so that you can help someone. There are people who are helping people by just following these things online. You spare life that could die. Like when we'll be studying on how to deal with right side heart failure. Person comes with holding a chest like this, very simple mechanism like taking and pricking somewhere and then life comes back. You get it? Thanks so much, Miriam. Oh, Boss KE, thanks so much for you coming in. Yes. So anyone with any question before I log out on the topics that we have discussed on we have discussed on heart failure. I summarized, we said, thank you, Dr. Men, very informative. You see, Majay, thanks so much. I feel nice when people appreciate. I feel nice. Now, you see, as I finish, I've said heart failure are categorized in the first one based on ejection fraction, the second one based on the heart side that is having a problem, the third one based on onset, is it acute or chronic, the fourth one is based on cardiac output, and we have discussed all these problems. So guys, share this content and talk to people. I'm concerned a lot. I'm really concerned a lot when it comes to students. If you know, this is just an appeal to whoever is watching. Yes, thanks, Boss One. This is just an appeal for whoever is watching. If you have in your household a student, if you have in your household a student, introduce that student to this platform. That student will gain a lot. Any medical student, just tell that student, please follow Benjamin the Wise Guy. That student will learn a lot. So thank you so much on everyone that has been in the platform, everyone that has supported, who has been in. Tomorrow we are continuing with the other problem on heart failure, which is cardiomyopathies. We will do, let me see the topic that we will do. Let me see the topic that we will do. Tomorrow we can do, I'm finding, I'm going through the topics so that I can know which topic we can do. We said we have 20 complications of the heart, and the first one was heart failure. I've explained about myocardial infarction, but we will talk about myocardial infarction in full tomorrow. So tomorrow's topic will be myocardial infarction. Thank you so much for tuning in. May everyone have a blessed day. Bye. See you guys tomorrow. Bye bye.